The investigation of bite marks is becoming increasingly prevalent. Many cases are now being examined which were previously ignored when it was not fully appreciated just how much information could be derived from bites. Unfortunately, technical problems still exist in recording bite marks in a manner which will permit satisfactory interpretation. The first consideration in examining a bite mark is the agent or animal which inflicted it. The size and shape of the wound will usually indicate whether it was inflicted by human or animal dentition. Human bite marks are frequently encountered in cases of murder, sexual assault, as well as in the battered baby syndrome. A bite inflicted by human dentition will reflect the characteristic arch shape and size. In addition, the anterior teeth in the human are roughly similar in size. Therefore, it's obvious that these even, crescentic bite marks were produced by a human. This particular case is a battered baby syndrome where the father inflicted the bites on the trunk and face. Bites may also be inflicted by many animals, either before or after death. Bites from dogs and cats are common. The dentition of both animals are quite different from humans, in that the arch is more rectangular and the canine or eye teeth are very prominent. Therefore, bite marks resulting from a dog or cat will either show characteristic puncture wounds from the canines or will take the form of slashes as the large teeth rip through flesh. For instance, the wounds on the back of this child were inflicted by a dog. The deep slashes are clearly visible. Less frequently, bites are caused by farm animals, pigs, horses, and even cows. Again, there is little difficulty in comparing the bite mark with a particular dentition. Bodies are sometimes bitten after death. Rodents produce small wounds as they gnaw. They can eventually strip all the flesh away from a limb or even the entire body. Teeth like these produce wounds which are ragged and relatively shallow. Dogs have also been known to bite corpses. There are several recorded cases where a dog inflicted severe wounds when locked in a room with a person who had died of natural causes. In this case, the head was completely removed and the flesh stripped from one arm. Bites are not only found in the skin, but also in a number of materials, particularly foodstuffs. For instance, bite marks have been recorded from cheese, chocolate, fruit, pastry, and chewing gum. An excellent impression may be left in food, as can be seen in this piece of cheese, where there is little difficulty matching the bite mark with the dental model of the suspect. Bite marks have been recorded on almost every part of the human anatomy, but certain sites are suggestive of the nature of the attack. The ears, forearms, and fingers are usually bitten during the course of a normal fight. However, in cases of sexual attack upon women, bites tend to be found on the neck, breasts, abdomen, and thighs. When examining bites of the skin, it should be noted that size and shape distortion will occur due to the skin's soft and elastic nature. Therefore, dimensions can be apparently altered. When faced with inspecting a bite mark, the question of how long ago it was inflicted must be considered. In a non-penetrating wound, the color changes from red to purple to blue and to green and yellow with the passage of time. The time taken to change from purple to greenish yellow is approximately 8 days. There are two ways of recording a bite mark: photography and impressions. Photography is generally the most efficient technique, and black and white or color can be used. Color photography is probably the method of choice, in that subtle changes are more evident. All photographs must have a scale to permit accurate comparison with subsequent dental models. If the bite mark is so faint as to be a problem for conventional photographic techniques, then the use of infrared photography might be helpful. This technique requires special film and filters, but can sometimes reveal bruising not otherwise visible. Since both techniques may reveal specific features, it is advisable to take normal and infrared photographs from the start, so that the entire dentition will be revealed in a composite. The appearance of the bite mark in a living person will change with time, and hence the mark should not only be photographed immediately, but also at 12 hourly intervals over a couple of days in order to obtain maximal information. If the bite has produced indentations in the skin or other objects, it is sometimes possible to obtain an impression. Several dental impression materials are available for this. Rubber base is suitable since it will produce an accurate impression while causing minimal distortion. The rubber base is being poured onto a bite, allowed to set, removed, and a plaster model of the bite prepared. This technique is just as easily done with foodstuff and other objects. About 80% of the population secrete ABO blood group substances in their saliva. Therefore, it is often possible to identify a person's blood group from a small amount of saliva. Frequently, there is sufficient saliva left from a bite on food or even on the skin to detect the blood group substances. When a bite mark is to be examined, the surface should be gently swabbed with a pledget of cotton wool soaked in saline, which is then examined for ABO blood group substances. Once the bite mark has been adequately recorded, it is necessary to obtain data from various suspects. First, a sample of saliva, as well as blood, is taken in order to establish blood group and salivary secretor status. Next, an impression of the teeth is taken. A standard impression technique is used, and stone models are prepared. In practice, it is convenient to make duplicate models so that a second, unmarked set can be preserved for the records. Wax bite registrations are taken and the models mounted on an articulator. Using these mounted models, bite marks may be made in a sheet of wax for comparison. An additional procedure is to make an outline of the teeth on a transparent acetate sheet and match this with the life-size photographs of a bite mark. Finally, it is necessary to obtain a sample of saliva and blood from the victim in order to establish their ABO blood group and salivary secretor status in case of contamination or self-infliction of bites. The legal position with regard to bite marks varies greatly. Each case really has to be examined on its individual merits. There are well-recognized difficulties in obtaining accurate recordings and matching these with the dentition of a suspect. It is more often possible to definitely exclude a suspect rather than to incriminate them. However, evidence from bite marks is now being accepted more frequently by the courts, but usually in conjunction with other evidence. In conclusion, bite marks appear fairly commonly on skin and other objects. A considerable amount of information can be obtained from bite marks, and care should be exercised in seeking this form of evidence. When a bite mark is to be examined, the following procedure is advised. Photograph the bite mark immediately without touching the surface. Swab the surface gently to obtain traces of saliva. Take an impression, if possible, of the bite mark. If the bite mark is in a living person, photograph the bite over several intervals of time. If the bite mark is in food or a dead body, it should be preserved for records.